Hello everybody. Today we are in conversation with Mr. Sakhi John. He is the assistant professor at Jamia Hamdard, and I think words would be less to define his valor in the industry. So welcome, sir.
Thank you.
How are you feeling today?
Always. So really like to congratulate all of you for this wonderful day.
So how are you feeling about the health concept and how is the atmosphere here?
Yeah, absolutely fantastic, because actually this is a common platform you are creating for the entire the entire digital health players to come in one platform and work together. It's a really great initiative. I really congratulate all of you.
So when we speak about digital health, I mean now we have platforms like ABDM and government is doing a lot of work in that direction. So where do you see it going? Like where are we heading to?
Right. See, when you talk about ICC ABDM, right? So it's a great initiative from the government of India. There is no doubt. Right? So especially there is a problem with there is a wide gap between the rural and the urban healthcare or urban India. Especially when you talk about the population, right? It's the 70% of population still living in the rural area, right? The 30% is in urban area. But when you talk about the resources, right, or the resource distribution, the 70% of the resources are concentrated or focused on the urban area, and only 30% for the 70% population. So there is what I'm saying is actually there is a wide gap between the urban and rural healthcare quality, in terms of quality, accessibility, availability. So ABDM is one of the great initiatives. It's a great platform to integrate not only the hospital, the entire health care setup. When you talk about this ABDM, it's a pharmacy, right? The clinics, right? The general practitioners, the hospitals, and the lab, diagnostic facilities. So enter this thing actually, even as each and every the individuals, right? Like the pharmacists, right? Actually, so everyone will come in actually the one platform, right? So that is the beauty of actually this the ABDM platform. So I hope actually within next 5 years actually it will come to the.
So having said that, I mean we have conferences like today is a conference, and we have multiple conferences going on. And I want to know from your point of view that what are the contributions from these conferences in the direction of digital health? Like,
right. So especially actually we are talking about actually the AI, right? The artificial intelligence in the public health and the hospital. So today's actually the AI, when you talk about actually the digitalization, AI, everything, right? It's more or less actually we are focusing on actually the private players, with the private players or actually the urban area. So what I'm saying is actually it shift the hit in a rural population. Then only actually we can see that actually the 100% accessibility. Today actually we have actually the other which you right actually so we have a health card. Right, really actually this kind of services should available for the rural population as well in terms of radiology or actually any kind of actually the diagnostic, maybe the teleconsultation, telemedicine, whatever we talk, right? But through AI, it should reach the 70% population or actually the rural. Then actually we can say that it's a 90% we have actually.
and also like when we say about having the implementation of these things in the rural area, do we see some resistance from there and there as well? I mean,
Yeah, absolutely, right. So especially when you talk about as the senior people in our healthcare setup, especially the doctors, right? So many of them are actually they are not actually the IT savvy, right? So and somewhere actually there is some kind of actually the challenges or issues with actually their what do you call approach towards actually the digitalization. But nowadays the people are aware what are the advantages of actually the computerization or the digitalization, and the youngsters, right? Hope is with actually the youngsters, right? So the 70% of actually the youngster or young doctors are there, or actually the paramedical staffs are there. So they will definitely actually they will I think they will take it forward, right?
so having said that, I mean we have a bright future for digital health in
Yeah.
India. And so, like summing it up, what would be that one technological development that you have seen which has been a game changer? I mean, so far, like if I would say that we have wearable devices. I mean, for me, it is a game changer. It helps me monitor day-to-day activities. So, is there any of such discovery?
See, only actually the thing you should realize that actually, so public health or actually the healthcare setup, AI alone cannot do anything, right? So you need actually the human intervention, right? Because actually you're playing with the patient's life, right? So what I'm saying is actually if you're integrating this information itself, it's a very huge asset for India, right? Maybe in terms of actually the clinical research, maybe in terms of actually the epidemiology, then we talk about actually any other this data itself is a very big game changer, right? So the huge data.
So having a data pool
Absolutely, the data warehouse and absolutely. So that's a way actually.
We can study the disease pattern and discover things in that direction.
Absolutely. Because when you talk about actually the disease trend is changing, right? Or disease pattern is changing. We are almost actually we are facing the triple burden of disease, right?
Yes.
Not only
Yes.
not only actually the nutrition problems, now actually even pandemic is a very big issue. So when you talk about actually the India, like we have actually almost 140 crore people in our country, right? So we cannot afford to have actually the curative and the rehabilitative care. So you have to focus on actually the preventive, right? So for that, yes, you need actually the huge data center like that.
Okay, so that was a great session. That was me, Dr. Ayushman
Thank you.
Bharat, in conversation with Dr. Sakhi John. Thank you so
Thank you,
much,
Vasu.
sir.